just trying to manage this medication and delay the process can actually cause more harm if the action is not taken earlier. Is that true?
So very different. Okay, yeah, that's healthy. Yeah.
That's healthy.
Yeah, that's healthy. Yeah.
So we'll take that. we'll take that over
okay.
boiled potatoes with olive oil and herbs.
Yeah.
If they developed severe reflux, which may happen, what treatment options are available right now? Number 8, grilled halloumi sandwich. What the hell is that? Versus baked chicken thigh with vegetables.
Sometimes the symptoms may not be solely related to the physiological refluxing of acidity into your esophagus.
This week on UnitedTV's Bariatric Friday, Kemal Erkan and Dr. Donovan Hui discuss treatment options for acid reflux, including medications, surgery decisions, and life after bariatric procedures.
There are newer classes of medications called PPIs as well. Those are also available and also very effective at treating reflux symptoms. And then while they're going through the evaluation, we'll do the endoscopy to confirm and evaluate for the severity of reflux in terms of how it has changed the esophagus lining. If their symptoms are well controlled, and if there is no significant esophagitis, it's very reasonable to still proceed with a sleeve gastrectomy, because weight loss by itself from that surgery can oftentimes resolve the reflux symptoms. If the patients have ongoing symptoms with maximal medical therapy, or if they have significant changes on endoscopy, bypass would probably be the preferred surgery. Keep in mind though, sometimes the symptoms may not be solely related to the physiological refluxing of acidity into your esophagus. There's a subset of patients who have what's called functional dyspepsia, and that's not necessarily reflux, as in there's not a lot of acidity that can be measured in the esophagus. It's more of a hypersensitivity to what's going through the esophagus that may have them experiencing reflux symptoms, but without the actual function of acid going up into the esophagus. So patients may still have discomfort or heartburn symptoms even if they get a bypass surgery.
And you know, in the case with reflux, you mentioned earlier again where, you know, when the patient's on certain medications, so because some of these patients, they don't come to the bariatric surgeon, they go to the GI specialty, and in some cases between the PCP and GI, they try to manage this with the medications for a long time. And I think the key point is, if the medication is going to work, it would work in the initial trial. So then if it's not working, just trying to manage this medication and delay the process can actually cause more harm if the action is that true?
So it can, but the risk is actually pretty low. The risk of developing esophageal cancer even after developing Barrett's is pretty low too. So the key here is understanding where and when to transition towards an endoscopy for further evaluation or surgical evaluation in these patients, because you don't necessarily have to have a bariatric surgery to help with reflux. There are anti-reflux surgeries that aren't bariatric surgeries, right? And that's something that we also do. But what's important is to understand that if your therapy isn't working for that 8 to 12 week trial period, that's a strong indicator that we should do something more in terms of evaluating for reflux and evaluating for other disease processes associated with reflux, because you may have the symptoms and you may have reflux symptoms that aren't getting better because you have a hiatal hernia. You don't really see that unless you do a swallow study or a CT scan, or what we commonly do is an endoscopy, and we can see them. Sure.
Now, when we have a patient who didn't have reflux or GERD problems before the surgery, so we went with a gastric sleeve.
Okay.
So then if they developed severe reflux, which may happen, so what treatment options are available right now?
So there's a couple of things. Well, one, we have to see where they are in their weight loss process. Okay,
Right.
So sometimes those reflux symptoms may be transient, and as they lose weight, those symptoms will go away. While they're having the symptoms, we're obviously going to treat it so that make sure the patients are comfortable, and that's the medical therapy, the antacids. There's a number of them, in addition to the proton pump inhibitor, right? So we'll give them medication. We'll see where they are in their weight loss journey. We'll see a repeat endoscopy to evaluate for anatomic issues that can contribute to a symptom of reflux. So sometimes even after a sleeve, there may be kinking of the stomach anatomy that can cause or exacerbate reflux, or there may be a hiatal hernia where the sleeve stomach has progressed up into the chest because of, most likely it's related to the sleeve surgery. As you do the surgery, it can predispose you to a hiatal hernia actually. And their ultimate transition from that surgery with significant reflux symptoms is conversion to a gastric bypass.
And for younger patients, so that's always an option. So like sometimes going to the bypass for someone who's, let's say, 27, 30, 35, since the bypass is always an option, so trying to go with sleeve is probably the safe way if they don't have the reflux and diabetes, of course. So because that's always as you said, it can be the next for the surgery. So overall, with people who are watching this and they struggles both like the obesity and chronic acid reflux, what's the most important step that they should be taking?
Well, I think the big part of that is just coming to see us, right? If you have a question about it, we're here to help answer those questions and help to kind of guide you through reflux, obesity, how reflux is played into obesity, and how we can manage, honestly, both at the same time.
So you are saying they shouldn't go to ChatGPT and trying to diagnose themselves and then have a plan of treatment, right?
Well, so ChatGPT does give a certain degree of an algorithm, actually. It's not bad, but when you have very specific questions about your own personal health, it's important that you see a provider, because there's an art to medicine, and that requires us to take care of you as an individual as opposed to take care of you as a population.
All right. So I think that's all I have for the questions. So we are going to go to the fun part. So I didn't see the list earlier, so it's also...
I think Faith sent it.
I just look at it now. I'm just being honest. So they didn't send it to me before. So I'm going to see it on the screen with... okay, we are doing this or that.
It's a this or that.
Oh, that's even more challenging. So this is not rated with, so this is this or that. So you're going to choose one of them. All right. Beef stir fry with vegetables or falafel bowl with tahini.
Good
but
food.
which one do you pick, though?
I think if you're looking for healthy options,
from the
falafel.
bariatric, so that's better than the beef.
In general, they're healthy.
All right. Sushi burritos or whole grain turkey avocado sandwich. So
I mean, I like sushi, but the answer I would give is a whole grain with avocado.
So again, patients, people who are struggling with morbid obesity is the key. So, but I think these are pretty obvious ones. So I think they are getting a little bit easier. Mozzarella caprese plates or avocado toast. What's avocado toast?
I think just toast with avocado on it, right?
So.
Yep.
Mozzarella caprese salad, is that what it was? Yeah, that's a healthy option, yeah.
All right, so that's better than avocado. So like the vegans are out. So is it minestrone?
I think minestrone?
Minestrone soup versus stuffed
minestrone,
bell peppers.
That's a hard one. I mean, depends on what you stuff the bell peppers with, right?
With lean beef and rice.
That's a hard one, actually. I think they're pretty equivalent in terms of health options, but I would lean on the side of the minestrone
With
soup.
I'll probably go with the other one, but of course, again, you are the surgeon, so we are going to follow your lead. So the next one is banana oat pancakes versus chai seed pudding with almond milk.
You're giving me a tough one. I feel like a lot of these are actually very nuanced in terms of nutritional value. I would go with the chai seed.
So this is from the Comfort Healthy versus Functional Healthy. So refined grain versus fiber-rich combo. So is it couscous with roasted vegetables or roasted sweet potato and black bean bowl? Couscous? Black beans. Couscous is the bulgur-ish, like.
Yeah. Those considered high fiber? I mean, black beans are by themselves as a good option. Well, that's what's with the black beans? I'm getting hungry now.
Roasted sweet potato and black bean bowl. Roasted sweet potato. I think the couscous, right?
Probably couscous.
Yeah, we'll go with couscous.
Yeah.
All right. Okay, now the next one, you're on your own. Okay, I won't help you on this one. Rice noodles stir fry with shrimp or lentil arugula salad?
Oh, lentil arugula salad is going to be
Okay, see? Now you're doing okay. So again, you're on your own. Number 8, grilled halloumi sandwich. What the hell is that? Versus baked chicken thigh with vegetables.
The baked chicken is healthier.
So next one is, okay, so this is good, and I can give you a lot of insight on this one. Buckwheat bowl with veggies or jasmine rice with grilled tofu.
Buckwheat, I think, is...
Buckwheat is really good.
Yeah,
I can tell you,
buckwheat, I think,
like,
is a lot
that thing
healthier.
is, especially with people with gluten allergies, replacing rice, bulgur, couscous with buckwheat is really good. And I'm doing that actually, like twice a week or so I eat that. And I don't like white rice, or like I used to have bulgur naan. So that thing works so great and is super healthy for GI. So number 10 is shakshuka versus boiled potatoes with olive oil and herbs. Shakshuka versus, do you know what shakshuka is?
Isn't that like fried cheese? Is that what it is?
Is it the shakshuka?
I don't even know what it is.
This is the, I think it's with eggplant.
Eggplant, okay.
Right.
I thought that was musak.
That's two. There's also,
Maybe it's well, I mean, it sounds healthy.
there's a picture there if you wanna.
Yeah.
Oh, okay, so that's very different. Okay, yeah.
That's healthy.
Yeah, that's healthy. Yeah.
So we'll take that over
that's
boiled
healthy.
potatoes with olive oil and herbs.
Yeah, that's,
Okay, so this wasn't too bad.
Yeah, no, it was great.
So I think the pictures do help. So
I don't have the pictures in front of me.
no, I just saw it.
Yeah.
Well, we are trying to help the patient with some fun facts, and I think this is getting a good reaction from people. So, well, thank you for joining us.
No problem.
So, reflux is a really important condition. It can develop to a more serious level, or it can be just uncomfortable. So, and no one should go through that. If they are getting treatments already, they should continue. But if the things are not getting better, seeing a surgeon would be the next thing to do. And Dr. Donovan Hui is specialized in reflux, and at CRIAS and American Surgery Center, we'll be able to help our patients with those conditions. And thank you for being with us, and until the next Bariatric Friday, please stay united. Bye-bye.
For more conversations like this, be sure to subscribe. See you next time on United TV's Bariatric Friday. Stay united.